NHA Practice Test CCMA. Question 1. A medical assistant is preparing to perform an audiometry test. What environmental factor is most important to control during the test? Room temperature, ambient noise level, lighting conditions, patient's diet prior to the test. Audiometry measures a person's ability to hear various sound frequencies. External background noise can interfere with the patient's ability to hear test tones, leading to inaccurate results. A quiet environment, ideally a soundproof booth, is essential for accurate hearing assessment. Question 2. A medical assistant is explaining a restrictive endorsement on a check to a patient. Which statement correctly describes a restrictive endorsement? It allows anyone to cash the check once it's signed. It means the check can only be deposited into a specific account. It is used when the check is being transferred to a third party. It requires 2 signatures to be valid for cashing. A restrictive endorsement, e.g., for deposit only followed by an account number, limits what can be done with a check, making it the safest type. It ensures the check can only be deposited into that specific account, preventing it from being cashed by anyone else if lost or stolen. Question 3. A medical assistant is preparing a patient for a spirometry test. The patient should be instructed to drink a large glass of water immediately before the test. Hold their breath for 30 seconds before exhaling into the spirometer. Exhale into the spirometer with maximum force and effort. Inhale slowly and steadily into the spirometer. Spirometry measures lung function, specifically maximum forced expiration. For accurate results, the patient must exhale with maximum force and effort after a full inspiration, measuring forced vital capacity, FVC, and forced expiratory volume, FEV1. This is critical for diagnosing lung conditions. Question 4. A medical assistant observes a patient with severe abdominal pain enter the clinic lobby. The patient states they do not have insurance. What is the most appropriate initial action considering federal regulations? Inform the patient that they must present proof of insurance before being seen. Have the patient complete all registration paperwork and financial forms immediately. Escort the patient to an examination room for a medical screening examination. Advise the patient to go to the emergency room as the clinic does not handle severe pain without insurance. Under EMTALA, anyone presenting with an emergency medical condition must receive a medical screening examination regardless of ability to pay. Severe abdominal pain may indicate an emergency, so patient care comes before financial or administrative tasks. Financial status cannot impede initial care for potential emergencies. Question 5. A medical assistant is administering an intradermal injection. Which of the following angles of insertion is correct for an intradermal injection? 90-degree angle, 45-degree angle, 25-degree angle, 10 to 15-degree angle. Intradermal injections are administered into the dermis just below the epidermis. The correct angle is a shallow 10 to 15 degrees, ensuring medication remains within the dermal layer. This creates a small wheal or blister, which is the expected outcome for tests like PPD for tuberculosis screening. Question 6. A medical assistant observes a colleague repeatedly violating HIPAA by leaving patient charts open on the counter and discussing patient information in public areas. The medical assistant's attempts to speak to the colleague directly have been ignored. What is the most appropriate next step? Continue to ignore the behavior as it is not directly harming patients. Report the colleague's actions to a supervisor or the facility's privacy officer. Discreetly take photos of the violations as evidence. Confront the colleague more aggressively in front of other staff members. HIPAA violations compromise patient privacy and can lead to legal consequences for the facility. Since direct communication has been ineffective, escalation to a supervisor or privacy officer is the appropriate next step. This ensures violations are formally addressed through proper channels. Question 7. A medical assistant is preparing to perform a fecal occult blood test, FOBT, on a patient. Which of the following substances should the patient be instructed to avoid prior to the test? Iron supplements, acetaminophen, multivitamin with calcium, antacids. Iron supplements are known to cause false positive results on FOBT because they can mimic blood in the stool or cause minor GI irritation leading to bleeding. Patients are typically instructed to avoid iron supplements, red meat, and certain vegetables before the test to prevent inaccurate results. Question 8. A medical assistant is preparing a patient for a tuberculosis, TB, skin test, PPD. After injecting the solution, what is the expected outcome? Immediate redness and swelling around the injection site. A small pale wheal or blister should form at the injection site. The injected area should remain flat and unchanged. The patient should report a burning sensation. After an intradermal injection for a PPD test, the expected outcome is formation of a distinct small pale wheal or blister, indicating correct injection into the dermal layer. If a wheal does not form, the injection may have been too deep, subcutaneous, and the test may need to be repeated. Question 9. A medical assistant is reviewing a patient's laboratory results. The potassium level is 2.8 milliequivalent/L. Which of the following terms best describes this finding? Hyperkalemia, hypokalemia, hyponatremia, hypernatremia. Normal potassium range is 3.5 to 5.0 milliequivalent/L. A level of 2.8 is below normal. Hypo dash means low, and kalemia refers to potassium in the blood, so hypokalemia means low potassium. Understanding these prefixes and suffixes is crucial for interpreting lab results. Question 10. A medical assistant is explaining advanced directives to a new patient during intake. Which of the following statements accurately describes an advanced directive? It is a document that determines who will inherit your property after you pass away. It outlines your wishes for medical treatment if you are unable to make decisions yourself. It is a legal document used to refuse all medical care regardless of the situation. It designates a family member to make all medical decisions for you in any circumstance. An advanced directive, living will, or durable power of attorney for healthcare allows individuals to specify their preferences for medical treatment in situations where they cannot communicate those decisions themselves. It empowers patients to make their own healthcare wishes known for the future. Question 11. A medical assistant needs to convert a patient's weight from pounds to kilograms for medication dosage calculation. The patient weighs 165 pounds. How many kilograms does the patient weigh? 75 kilograms, 60 kilograms, 70 kilograms, 80 kilograms. To convert pounds to kilograms, divide weight in pounds by 2.2, since 1 kilogram equals 2.2 pounds. 165 pounds divided by 2.2 is equal to 75 kg. Accurate conversions are essential for calculating correct medication dosages and preventing medication errors. Question 12. A medical assistant notices that the supply of sterile gauze pads is running low with only 2 boxes remaining in the storage room. The typical reorder time is 1 week. What is the most appropriate action for the medical assistant to take? Wait until only 1 box remains before placing an order. Place an immediate order for more gauze pads. Delegate the ordering task to another medical assistant. Inform the clinic manager that the supply is low. Proactive ordering ensures that essential supplies do not run out, which could disrupt patient care. Considering the 1-week reorder time, placing an immediate order prevents a critical shortage. Waiting until the last box is opened risks running out before new supplies arrive. Question 13. A medical assistant is preparing to sterilize instruments using an autoclave. Which of the following best indicates that sterilization has been achieved? The autoclave's temperature gauge reaches the required level. The indicator tape on the outside of the package changes color. The biological indicator, spore test, shows no growth. The timer on the autoclave reaches the program duration. While temperature gauges, indicator tape, and timers show that physical conditions for sterilization were met, they do not guarantee all microorganisms, especially resistant spores, were killed. A biological indicator, spore test, directly measures killing of highly resistant bacterial spores, making it the gold standard for confirming true sterilization. Question 14. A medical assistant is performing a urinalysis using a reagent strip. The strip shows a positive result for nitrites. What does a positive nitrite result most likely indicate? Diabetes mellitus, kidney stones, bacterial urinary tract infection, UTI, dehydration. A positive nitrite result on a urine reagent strip is a strong indicator of a bacterial UTI. Certain UTI-causing bacteria convert nitrates, normally present in urine, into nitrites. While a negative nitrite test doesn't rule out a UTI, a positive result is highly suggestive of bacterial infection. Question 15. A medical assistant is administering an intramuscular injection to an adult. The needle is inserted and a small amount of blood is aspirated into the syringe. What is the appropriate action? Withdraw the needle completely and prepare a new injection. Continue with the injection as a small amount of blood is normal. Pull the needle back slightly, redirect, and then reacerate. Inject the medication slowly into the bloody syringe. Blood aspirated into the syringe indicates the needle has entered a blood vessel. Injecting IM medication intravenously can be dangerous, causing adverse reactions including rapid absorption or vessel damage. The needle should be withdrawn completely and a new injection prepared at a different site. Question 16. A medical assistant needs to prepare a patient for a colonoscopy. Which of the following instructions should not be given to the patient? Follow a clear liquid diet the day before the procedure. Take all prescribed bowel preparation medications as directed. You may eat a light breakfast on the morning of the procedure. Arrange for someone to drive you home after the procedure. A colonoscopy requires a completely clean colon for proper visualization. Ingesting anything solid, even a light breakfast on the morning of the procedure, is strictly prohibited. Patients are typically on a clear liquid diet and bowel preparation regimen for at least 24 hours prior to ensure the colon is empty. Question 17. A medical assistant is performing a capillary puncture. After puncturing the skin, the medical assistant should first wipe away which of the following? The first drop of blood, the second drop of blood, any remaining antiseptic, excess tissue fluid. The first drop of blood often contains tissue fluid, alcohol residue, or other contaminants that can dilute the specimen and interfere with accurate test results. Wiping away the first drop ensures subsequent drops are more representative of pure capillary blood for accurate testing. Question 18. A medical assistant is discussing HIPAA with a new employee. Which of the following actions would be a violation of HIPAA? Sharing patient information with a consulting specialist for treatment. Discussing a patient's diagnosis with their spouse without patient consent. Providing patient records to a court with a valid subpoena. Accessing a patient's chart to prepare for their upcoming appointment. HIPAA prohibits sharing protected health information, PHI, with anyone, including family members, without the patient's explicit consent unless it's for treatment, payment, or healthcare operations. Discussing a patient's diagnosis with their spouse without patient consent is a direct violation of the privacy rule. Question 19. A medical assistant is preparing to assist with a minor surgical procedure. The physician asks for a sterile solution to clean the wound. Which of the following is the most appropriate solution to use? Hydrogen peroxide, povidone iodine, sterile saline, isopropyl alcohol. Sterile saline is isotonic, meaning it has a salt concentration similar to body fluids, making it gentle on tissues and effective for rinsing without causing irritation or cell damage. Antiseptics like povidone iodine or hydrogen peroxide are cytotoxic and typically used for skin preparation before incision, not directly for cleaning open wounds. Question 20. A medical assistant needs to obtain a specimen for a throat culture. Which of the following areas should the medical assistant prioritize swabbing? The tonsils and posterior pharynx, the inside of the cheeks, the roof of the mouth, the tip of the tongue. The goal of a throat culture is to identify pathogenic bacteria, typically causing strep throat. Swabbing the tonsils and posterior pharynx, back of the throat, is essential because these are the areas where causative organisms are most likely to reside, avoiding contamination from the tongue, cheeks, or uvula. Question 21. A medical assistant is performing an EKG. The patient has large breasts. What is the most appropriate action regarding electrode placement for leads V4, V5, and V6? Place the electrodes directly on top of the breast tissue. Place the electrodes under the breast, lifting the breast tissue if necessary. Ask the patient to hold their breasts out of the way during the entire procedure. Skip these leads as accurate placement is not possible. Placing electrodes directly on breast tissue can distort the EKG tracing due to electrical interference. The most appropriate action is to place the electrodes under the breast, gently lifting breast tissue to ensure proper skin contact at the correct anatomical location on the chest wall for accurate readings. Question 22. A medical assistant is performing a venipuncture on an elderly patient with fragile veins. The medical assistant should use which of the following techniques to minimize vein collapse and hematoma formation? Use a large gauge needle, e.g. 18G, and rapid draw. Apply the tourniquet very tightly and leave it on for an extended period. Use a smaller gauge needle, e.g. 23G or 25G, and a winged infusion set. Anchor the vein firmly above the venipuncture site. Fragile veins are prone to collapse or bruising. Using a smaller gauge needle, 23G to 25G, and a winged infusion set, butterfly needle, creates less trauma and provides more control with less pressure, reducing the likelihood of vein collapse or hematoma formation. Larger needles would increase risk of damage. Question 23. A medical assistant is obtaining a chief complaint from a patient. The patient states, "I've been feeling sick to my stomach and I've had diarrhea for 3 days." Which of the following elements of the chief complaint is missing from this statement? Location, severity, duration, quality. The chief complaint components include location, severity, duration, and quality. The patient provided duration, 3 days, and quality, sick to stomach, diarrhea, but did not specify the location of the stomach sickness, e.g., upper abdomen, lower abdomen. Specific anatomical location details help narrow down potential causes. Question 24. A medical assistant is preparing to measure a patient's pulse. Which artery is most commonly used for routine adult pulse assessment? Brachial artery. The radial artery, located on the thumb side of the wrist, is most commonly used for routine pulse assessment due to its easy accessibility and clear pulsation. The carotid artery is used for emergencies, the brachial for blood pressure, and the femoral for lower limb circulation assessment. Question 25. A medical assistant is reviewing a patient's medication list. The patient is taking warfarin, Coumadin, Which of the following laboratory tests should the medical assistant expect the physician to order regularly for this patient? Complete blood count, CBC. Thyroid stimulating hormone, TSH. Prothrombin time, PT/INR. Hemoglobin A1C. Warfarin is an anticoagulant, blood thinner. To ensure therapeutic levels and prevent excessive bleeding or clotting, patients taking warfarin require regular monitoring of their blood's clotting ability. The PT/INR test directly measures clotting time and is essential for adjusting warfarin dosage to maintain safe and effective levels. Question 26. A medical assistant is sterilizing instruments in an autoclave. After the cycle is complete, the medical assistant notices that the sterilization indicator tape on a package has changed color, but the package itself feels wet. What is the most appropriate action? Remove the instruments and assume they are sterile as the tape changed color. Recalibrate the autoclave and run the same cycle again with the wet package. Consider the instruments unsterile and reprocess them completely. Dry the package manually and then store it with other sterile instruments. A wet package after autoclaving means the instruments inside are unsterile because moisture compromises the sterile barrier, allowing microorganisms to wick through the packaging material and recontaminate the instruments. Even though the indicator tape changed color, wetness indicates contamination, and the items must be reprocessed completely.